Well, let me take this opportunity to welcome everyone to today's health update. Good afternoon. In just a few moments, I'll turn things over to my partner, Dr. Virginia Kane from the Marion County Department of Public Health. But before I do, I would like to add my voice to a chorus of fellow mayors from across the state, from across the country, with a very important message. We need the federal government to act quickly and decisively to provide assistance to families, to provide assistance to businesses, to first responders, all of those who are bearing the brunt of this extraordinary surge in the number of COVID cases. We see it now as the end of the year rapidly approaches. 8.5 months after it was first passed, we still have no follow-up to the impactful and the effective CARES Act that was passed by Congress back in March. The federal funds that were available for Marion County and the city of Indianapolis as a result of a direct appropriation of $168 million. Well, that money was used to help small businesses to the best ability we had stay afloat. Those funds allowed for families and businesses to weather out and implement our most effective public health strategies. It allowed us to provide rent relief, mortgage relief, food relief, free masks, and more. And in 3 weeks from now, those funds will be gone. The gridlock and the resulting inaction from Washington has run the gamut. Initially inconvenient, it quickly became baffling, then frustrating, and then and now unconscionable. I am left with no other way to describe it other than deadly. Dr. Kane is about to outline the latest trends and our continued mitigation efforts. But many residents will want to know what more they can do to help. What can they do to keep their favorite restaurant open? What can they do to save their local stages? What can they do to provide relief to our medical professionals and ease the pain of their friends and family members who continue to be impacted by this pandemic? Well, beyond continuing to socially distance, washing hands regularly, practicing good hygiene, wearing masks in public, I'll add one more thing that all of you, each and every one of you, can do. Write or call the leaders of Congress, both Democrats and Republicans, and demand action. Insist on action. Further delay is inexcusable. Today is the start of our 10th month in this public health crisis. And I I know I'm not the only one who's frustrated. This year has been a trial for all of us. Our collective patience is thin, and it is times like these that we must work harder to find the glimmers of hope amidst what feels like an ocean of darkness. But this evening, many across our city will also find themselves at the start of a holiday season known as the Festival of Lights. Beyond wishing our Jewish neighbors a safe and happy Hanukkah, I urge all residents of the city of Indianapolis to take strength in the story of perseverance and miraculous victory. Through Thanksgiving and the reciting of Psalms, we are reminded that this is far from the first time of darkness that the world has seen. These are the times in which we all must rely on that which gives us strength, whether that be family, friends, or faith. Unity is the greatest weapon against this virus. We have avoided the very worst because so many community members have come together to help one another. So my deepest thanks to all of the residents of Indianapolis for the commitment that most all have shown, for the sacrifice that most all have shown, and for the patience that most all have shown, especially the patience of our healthcare workers. So now, with the very latest in data and with updates to mitigation efforts, I'm very pleased and proud to pass things to Dr. Virginia Kane, the director of the Marion County Public Health Department. Dr. Kane.
Thank you, Mayor Hotsett. If I could have the first slide. I'll take the next slide. I believe you may have jumped one slide, the second slide. Yes, thank you. Okay. So, Mayor, as the mayor has stated, we've seen a tremendous increase in our COVID-19 cases, not only in the state of Indiana, but across the country. And the impact that we have on our healthcare systems and our healthcare workers is tremendous. And Indiana ranks at the very top related to being inundated with so many cases of COVID-19. And this slide highlights that at the beginning of November, we were at a positivity rate of in the 11% positivity rate. These, remember, are the number of individuals who are positive in a community that determines community spread. And as you can see, the reminder is our gold standard is 5%, and we were less than 5% in the month of September for a period of 2 weeks. And then we have suddenly started to increase since late September, where we saw an increase in the month beginning of October, the first week of October. So you will see that currently right now, we are through December the 2nd up to a 14.6% positivity rate. And based on our old dashboard criteria, we had made the recommendation to close all schools and have them only virtual based on our prior criteria that we had at the 13%, which occurred just right after Thanksgiving. Next slide. So when we look at the percentage of cases, when you look at the percentage of newly formed cases, I'm sorry, next slide. When we look at the number of new cases we've experienced several days of over 1,000 cases reported in Marion County, which was a real concern for us. And as you can see here, we look at a 7-day average of the number of cases that we see, and we have now reached up to 939 cases. But if you go back all the way to the beginning of November, you can see that we were averaging in the 300 some cases per day over a 7-day average. So we have tripled our number of cases since the beginning of November currently through December the 5th. Next slide. Our emergency room visits have increased, and we were at about 40 emergency room visits back at the beginning of November, and we've now doubled our emergency room visits with COVID-19 symptoms to double the amount that we were seeing early November. And we're sort of kind of a little bit flat, but still a significant increase in just 1 month. Next slide. Our hospitalizations are continuing to climb with persons with COVID-19, and where we were averaging 20 hospital admissions a day, we're now up to 33 hospital admissions a day related to COVID-19 through December the 6th. Next slide. And along correlating with this, we are now seeing our deaths beginning to rise, and where we were having less than 2 deaths per day on a 7-day average, we're now nearly having 6 deaths per day in Marion County through December the 5th. Next slide. Now, how do we compare to the new cases occurring in the surrounding counties of Marion County? As you can see on the slide of our surrounding counties, all of our counties in the last month have seen an increase in their cases per 100,000 residents. So Marion went from 42 patients to 96 cases through December the 8th per 100,000 residents. You'll see similar increases at Johnson County, Hamilton County, and all of the counties with a substantial increase in their new cases per 100,000 residents through December the 8th. Next slide. When we see what's happening from an age distribution standpoint, we still find that from the seniors and older, that we're continuing to do a fairly decent job of reducing the cases in our senior population. And I have to say, I think the seniors are doing an incredible job. I believe wearing your mask, doing your social distancing, and washing your hands significantly, and avoiding individuals in your households that may be asymptomatic, preventing any infection spread to you. And so at 15%, we're doing a steady job. But always our 20 to 39-year-olds are having the bulk of contributing to the bulk of our COVID cases, with 43%, almost half of our cases in this age group 20 to 39, followed by the 40 to 59-year-olds at about 29% or 30%. So between 20 years of age to 59, they're making 70% of all of our cases for COVID-19. Still doing a fairly decent job with our school systems. And for those individuals under the age of 20 years of age, our school numbers from October all the way through November are continuing to range around about 14%. Our next slide. Now, this actually looks at the percent based on the age, what their positivity rate is. And so when we look at our 0 to 4-year-olds, they test positive about 1% in this community. When we look at our 5 to 10-year-olds, they're making up about 1.2% positivity rate in our communities. We look at the 11 to 13 years of age. These are our middle schools. And you can see that they make just a little bit under 2% of our population who's testing positive. Our high schools, when we look at the data from them, they're a little bit about 3.2%. But now let's look at the rest of the community and see what the positivity rate is. So the highest are in our 18 to 24-year-olds at over about 6.4%. Our 25 to 39-year-olds are at roughly about 5.8% positivity rate. Our 40 to 59-year-olds are at the 6% positivity rate, and our seniors are over about 5.5% positivity rates. Now, what's the significance of this slide? If you look at from 0 to 4 through 14 to 17, they make significantly less of the number of positivity rates of all of our cases in the community. So it would suggest that this particular group, especially our elementary and middle schools, are not contributing to our overall positivity rates in our community. And even our high school individuals, although they're much higher than our elementary, middle schools, they are still significantly less compared to the other age groups. Next slide. Now, despite that, this may look like it's a little complicated slide, but there are 4 rows here. And the first row in red shows the amount of COVID cases we were experiencing in the different age groups. So you can see less than 50 cases in August for all of the grades except for our high schools. But look at the cases in purple. These are the cases that occurred in November, the entire month of November. So you can see that even for the kindergarten, elementary school, and our middle school, as well as our high schools, we saw a significant increase in COVID-19 cases. So we went from about maybe 100 cases to now nearly 600 cases in our high schools that were reported to us just in 1 month of COVID-19 cases in Marion County. And we went from a little bit less than 600 cases for our 18 to 24-year-olds, where we had reported over nearly 1,700 new cases just in 1 month for the 18 to 24-year-olds. But despite that, when you look at the different age groups, still, even though we saw a tremendous increase in our cases, in November in the schools, they still appear to be significantly less if we look at the community spread overall, suggesting that they're not contributing as significantly to our COVID-19 cases compared to the other age groups in our community. So next slide. So one thing I have to tell you, the difference between our last press conference is that we asked for more data from the schools in order for us to get a deeper dive into what was happening with our children in the schools. And based on that deeper additional data from the schools regarding the staff, the faculty, teachers, and the students, we were able to do a more deeper dive about what's happening in the schools based on their grade levels. And even though the slide has a lot of lines related to it, I want to show you that when you look at the scale on the left where you see 50 cases or less, you will see that our kindergarten, which is the green line on the bottom, the elementary age, which is the red line on the bottom, and our middle school, which is the gold or more yellowish line on the bottom, all kindergarten, elementary, middle schools are less than 50 cases occurring per 7-day average. Now we're going to go and look at the high school, which is the lavender coloring. And if you look at the lavender coloring, they are at about 75 cases per 100,000. But when you compare it to the college student, which is that very top line, navy blue, you can see the college students are reaching almost 150 cases a day. Even our adults, from anywhere from 25 to 64 years of age, is slightly less than that. But then when you look at the high school, middle school, elementary, in less than 5 years of age, and I'll show you the next slide, which will help you see it a little bit better, you will see that even our high school students, even though they're much higher than our middle school and elementary school, they still appear to be significantly less than what we're seeing out from a community spread standpoint related to the number of cases that they are contributing to our community. Next slide. So, based on that deeper dive, okay, and looking at our data much greater, and then also related to the fact that CDC has just come out with new recommendations related to quarantine and isolation. They have shortened the period of days related to that, meaning that the recommendations are now that you can quarantine and isolate from 7 to 10 days. And based on that shortened quarantine period, we are now seeing that schools from 1st grade through 12th grade can return in person on January the 4th if they're able to meet these qualifications. The students and staff can be socially distanced, but masks will be required to be worn by staff and students in 3rd grade and above. And this is probably the most important point of all. Any parent, any student, and teachers are recommended to avoid any unnecessary contact outside of their household at least 10 days prior to the January the 4th return. That is so critical. We want you to be negative at the start of the school system on January the 4th. We were using the 14 days quarantine and isolation from the holidays, but since the CDC has shortened that quarantine period to as low as 7 days, we feel comfortable that our students can come back on January the 4th instead of our original public health order of January the 18th. Lastly, we are requiring group homes to require a negative test 72 hours before indoor visitation. And I believe I'll stop and take questions.
As always, we will use the question and answer feature at the bottom right of your screen. I will unmute reporters as we go. So first question is from Erica Washington.
Oh, hi. Okay, so why not keep the date to open schools January 15th? Why January 4th?
We were looking at from the Christmas holiday, if people can may get infected from social gatherings. CDC had recommended that the incubation period for new cases would occur within 14 days. And so that's why we had used the January the 18th date. But last week, or it may have even been this week, CDC has come out with new recommendations that is saying that the isolation and incubation period now can be as low as 7 days. So if you use 7 days, you have a 5% chance of transmitting the virus. If you use the 10th day, 10 days that they say that you can use instead of the original 14 days, you have a 1% chance of transmitting infection. So we're trying to look at around the 10-day mark instead of the original date.
Our next question is from Eric Berman.
Hi, Mark. Hi, Dr. Kane. Last time we got together on this subject, you were pointing to the levels of community spread. The original order was if we hit 13%, we've got to close. We've only gone up since then, as you noted. We're at 14.6, 14.7 now. We've got Thanksgiving's effect still coming and a Christmas effect still coming. What makes you confident we can open safely on the 4th?
So let me just say that one, we have a panel of experts that we utilize to help make decisions. And so what we also did just in the recent couple of weeks is we talked across the country with a lot of our colleagues that have had significant spread, but their schools have been open much longer than us. And based on the response of talking to my colleagues, and we have consultants, expert consultants, for example, Dr. Tom Frieden, who has a big contract from CDC Foundation in terms of going across the country and reviewing different school systems, who had made the recommendation that they felt now was a time that the data looks like it is safe to be in the schools despite our positivity rate of our 14.9%. So it's a combination of being able to dive in deeper to our data and carefully looking at it compared to what the positivity rate is in our school systems based on age grades, compared to our community spread, that we feel pretty confident that we will be all right related to the January the 4th date.
Eric, let me just add to Dr. Kane's observations. I mean, Indianapolis and Marion County throughout the entire pandemic, frankly, have had some of the most, if not the most stringent recommendations and requirements of any other community in Indiana for obvious reasons. We're by far the largest urban area in the state. We have the most densely populated neighborhoods in anywhere else in the state. But having said that, those stringent guidelines and recommendations have consistently, at all times, been driven by the data and the science surrounding that data. And that's why many of the recommendations and the decisions that Dr. Kane, the Department of Public Health, have been making and that I have been supporting, have met with a lot of political controversy. But at the end of the day, you have to have the courage to do what is right for the right reasons. And that is driven by the data and the science, and not bow to political pressure. That's not to say that you should ignore some of your critics and certainly take what they have to say into consideration. But you cannot and must not allow political pressure to drive these decisions. So what Dr. Kane and the Department of Public Health, I think, have done an outstanding job of doing is letting data and science drive the decisions, while at the same time always being mindful of the perspectives of the people as a whole. That doesn't mean compromise. That doesn't mean balancing acts. But what it means is that you listen to the feedback that people are giving you. And believe me, they give you a lot of feedback. And then ultimately make your decision based on the data and the science. That's what we'll continue to do. We are concerned deeply about educational opportunity for all students in Marion County at all levels. And so I'm particularly pleased and proud of the leadership that Dr. Kane has offered in this area in protecting our kids, making sure that our public schools, our private schools, and all other aspects, our charter schools, are adequately staffed, and our kids are protected and taken care of. So probably more than the question deserves, but it is a topic of tremendous importance. We seek to protect the health and the well-being of all residents of Marion County, but that's not to say that among the highest of our priorities, beyond those who are in vulnerable condition or who are aged and carry with it that vulnerability, but we also have a special prioritization on our school kids and their opportunity to attend school in safe ways.
Our next question is from Matt McCutcheon of WTHR.
Hello, quick question when it comes to the restaurants. There's a recent report out that says about 20% of restaurants have been forced to close this year. I know here in Indianapolis and Marion County, there's been the rollout of parking spaces along Mass Ave and Broad Ripple Avenue, which has now been extended into January. What other assistance is being done kind of specifically for restaurants going forward into 2021?
Yeah, I'm going to ask Thomas Cook to be specific as it relates to the many different ways over the course of these last 10 months that we have been, as a community, working closely with the Restaurant and Lodging Association to provide as much economic opportunity, viability as we possibly can through utilization of the Federal CARES Act support, as well as some of the some of the creative ways you mentioned in the question that Marion County and Indianapolis has tried to address those issues. Thomas?
Yeah, thank you, Mayor. I think the shortest way to summarize it would be that Marion County has had the ability to do a lot, but we know it's not enough. We received $168 million in the initial CARES Act allocation, and over the course of the last 6 months have deployed a whole host of business assistance programs, not just for the restaurant and hospitality industry, but certainly particularly targeting them as the pandemic has worn on. The most recent was the HELP Grant Program, which was done in conjunction with the Indy Chamber and the Restaurant and Lodging Association, which resulted in a little less than $12 million being directly allocated for rent, mortgage, and other fixed costs for businesses that are frankly struggling. And we've had other business assistance programs. We've had PPE grant programs that were in the millions of dollars. We've had a recent winterization program for restaurants and bars that was roughly $1 million. And the City County Council approved roughly $25 million in Paycheck Protection Program loan liquidity back at the beginning of the pandemic when that program was still functioning. At the end of the day, we have heard consistently here in Marion County that those programs have been effective, but they are specifically designed to be at most aid that only extends through the end of December. The CARES Act allocation that we received specifically said that we could not have that programming extend past 12/31 of this year. And so we're working diligently with the Indy Chamber, with Visit Indy, with our partners to get those funds out the door. But in direct answer to your question as to what more we could be doing, the answer, unfortunately, is after 12/31, our hands are very much tied in terms of deploying the types of resources we have been deploying at the levels we have been deploying them. And unfortunately, it's a time in which the need is even more acute than it ever has been, given that the cold weather has really curtailed much of the outdoor seating that was keeping these restaurants afloat during the summer months. So we obviously have urged Congress to act in the past. The mayor spoke about that earlier. But we're going to continue to talk to the City County Council and to other industry leaders as to whether there's local assistance we can offer, although we are mindful of the fact that ultimately it's a federal government-sized problem that's going to require a federal government-sized solution at the end.
Our next question is from Russ McQuaid of Fox 59.
And good afternoon. First of all, congratulations to Dr. Kane being named the recipient of the Bill Crawford Humanitarian Award. Dr. Kane, I'm sure the representative would be quite proud if he could hand that award to you personally today. So congratulations. When we're talking about reopening the schools, Dr. Kane, I'm wondering if we've taken a look at the vaccination protocols and priorities, and for instance, where will teachers and school staff fall in that priority list of getting the vaccination?
So initially, we're based on our understanding from the Indiana Department of Health and the vaccine delivery, our first dosages, which we're hoping to get out the door in this country with 20 million dosages. The first phase is going to go to the healthcare workers as well as the long-term care patients. And I believe then the second phase of phase one will have to do primarily with the different other type of healthcare employees like dialysis unit staff, individuals that have the highest morbidity and mortality associated with the vaccines are like our African Americans and Hispanic populations that will occur. But I believe my understanding is for the teachers, it will not, their ranking, I believe, is in the later phases, but not in the first phase initially. So trying to get the sickest people first that's been associated with morbidity and mortality. And the vaccine can only be given to individuals over the age of 16. So no one less than that, because the studies have not been done yet in pregnant women, children under 16, related to the vaccine, but the teachers will not be until a later phase after the healthcare workers and patients with the highest risks of morbidity and mortality.
Next question is from Russ Dodge of WITT.
Good afternoon. I wanted to know a little more about how businesses are complying and talk about penalties and enforcements that are continuing, and then want to know if there are any changes in restrictions besides what was announced yesterday at the state level regarding curtailing the elective surgeries in hospitals.
So there are several questions, so let me see if I can go through them. So I know that at least in Marion County, we'd had at least one hospital prior to this announcement that had gone, had already stopped their elective surgeries because of the number of patients that were being in their critical care units being filled up. I know the other hospitals were in discussions related to that, but I'm not aware what their final decisions are related to that. But based on the governor's recommendations, we will surely be having a orders related to the governor's recommendations, but his official document, my understanding, won't be on their website until Friday. So we're going to have to really be able to look and delve into all the recommendations that were announced at the press conference, and then be able to adjust our recommendations accordingly. And I think there was a third question there. So in terms of restrictions or whatever, until we have the opportunity to really look at their order very closely, we don't have any recommendations to date related to the businesses.
Yeah, and I was basically asking about the businesses, how they're complying, and how many penalties have you had to issue, and just kind of an overview of how that process is going.
So we, it's unfortunate we continue to have businesses who do not follow the rule, but we haven't had any major violations where we've had to shut the institution down. And so, and it has decreased, I will say, since the last 30 days, but still it's always a work in progress. Educating new people, always people getting into the business and they don't have licenses to be in the business. So they have had some violations related to that.
Our next question is from Sherry with IndyStar.
Hi, thank you for taking this question. Well, I believe sometime last month you talked about getting together with the counties surrounding Marion County to talk about maybe coming up with some sort of solutions across the Marion County, the donut area. In yesterday's state update, 5 of those counties had actually turned red. And as you pointed out, most of those counties have seen increased spread. Do you feel that the counties around us are doing enough to help curb coronavirus spread, since it's very easy to just drive to another county and put yourself at risk? If that's something that you want to do, would you like to see the counties do more? And if so, what?
You know what? Let me just say that each county is different, and they have different demographics, and they have different issues related to their patient population. And we've just seen such a substantial increase in the cases, and we've had substantial increases in our cases. I think our advantage, though, compared to some of the surrounding counties, was that we had stricter, with Governor Hotset's leadership, we had stricter guidelines in place, so that I think we have benefited so far not being a red zone because of our population density, that we've been very fortunate related to that. So I don't know if that's an impact with the surrounding counties because I'm not privy to all of the data that they're looking at and their investigations or where their cases are coming from. But, you know, this is a tough time. And I would say that over probably half of our counties, we're seeing our numbers driven up drastically. But I spent a good dialogue with our regional partners, and they feel that we're going to be working on having a really strong communications to all of our residents in our surrounding communities, because we do have people work from other counties into our counties, and we may have people who work here reside in those additional counties. And so it's just a tough situation, I think, for all mayors and all health commissioners.
And,
Yeah, I said yes. You may want to comment.
yeah, let me add just, I do feel for many of my colleagues, both Dr. Kane's colleagues in county health departments, as well as my own elected officials, colleagues, mayors, and frankly, county-wide elected officials in the surrounding counties. We do have, while we have the most challenging situation in the state because of the density of our population, because of the size of our city, because of the square miles that our city covers, we do have one advantage over and against all of the contiguous counties, our neighbor counties here in central Indiana, and frankly, many other throughout Indiana. And that is, it is much easier for Dr. Kane and me to speak with one voice because I happen to be the chief executive of the city and of the county. And I have at my disposal the benefit of professional expertise through the Marion County Department of Public Health. How is that different? Well, in all of our surrounding other counties, you have multiple mayors, multiple elected officials. You have a wide variety of different county health departments with a wide variety of different histories and responsibilities. And the mere coordination of a cohesive strategy in a lot of the corresponding counties is so much more difficult to reach because you have so many more actors that are at the table with their own voices, with their own perspectives. And I'm not saying that Dr. Kane and I get everything right, but we try, and we let the data and the science drive our decisions. And so at the end of the day, the city of Indianapolis, Marion County, and the Marion County Department of Public Health can fairly easily, quickly, and deftly develop strategies and implement recommendations in a much more quicker way than a lot of our contiguous counties. So I feel blessed that at least in Marion County, while we have overwhelmingly the largest number of cases to deal with, at least in many cases, we're able to speak with one voice and with one consistency.
Thanks, Mayor. Next up, we have Erica Herron of the Indy Star.
Thank you. I have two questions, one for Dr. Kane and one for Mayor Hogsett. First, Dr. Kane, why didn't we have this additional information before you ordered schools closed, after the Thanksgiving holiday? And does the evidence really show that schools should be open now? Should we have closed them at all? And Mayor Hogsett, can you respond to the frustration of parents who want to know why bars and restaurants are still open, why sporting events are still taking place while schools were the only thing really closed? And did this change in policy have anything to do with the petition filed to your office from a group of parents seeking to reopen their schools?
So can I just take a quick stab at that? So let me just say we've looked at all different entities when we've been making our recommendations. We've had the bars closed, let's just say for 6 weeks, almost 2 months, when we didn't close down the schools. So we look at our data, we see what our hot spots are, and we try to make recommendations accordingly, okay? And the same argument that the bars were making when we closed them down completely and we hadn't closed down the schools, they were saying the same thing. So we try to look at the science. We try to see where we're seeing increases in cases based on the science, what the latest recommendations are. And so we feel pretty comfortable just, looking at our contact tracing and other things that we put into place, why we're not shutting down the bars completely. They're at a 25% capacity. And we also have a system where we're trying to use waivers for schools, for those kids that are the most, have special needs. So our schools that are economically disadvantaged by definition of Indiana Department of Education, our students that have special education needs, that we will provide waivers for them to stay in person. So, but it's looking at the data, trying to get additional data. And just remember now, we thought we were looking really good until we hit late October, where our cases started to increase for the schools. But they were increasing at such a phenomenal large numbers. When we're experiencing over 1,000 cases a day, trying to really look at where might our problems be. And so you try to get as much additional data as you can in terms of making different decisions. So Mayor Hotsett, I'm sorry to jump in front of you.
I would answer the second portion of the question by reiterating a filibuster that I engaged in earlier in the conference, and that is the decisions that we make here in Marion County and the city of Indianapolis are driven by data and science. That is not to say that we are immune from concerns being expressed, as I think Dr. Kane very appropriately pointed out. It's not just parents that get upset whenever we request that school continue, education continues. So I always get a little concerned when we say schools are closed. They are not closed. In-classroom teaching has been postponed for several weeks, but schools continue to operate. Education and instruction continue to occur. Ultimately, if it's not parents who are upset, and believe me, I listen to all the parents who have what I consider to be reasonable and legitimate concerns that we attempt to address in safe and sound ways. And then finally, as a closing matter, the truth is that as Dr. Kane, I think, and I'll stand corrected, Dr. Kane, if I have misstated your position, but in no small measure, the recommendation to move the return to in-classroom instruction up about 10 days earlier than we originally had forecasted is, I'm sure, due to not only those factors that Dr. Kane has outlined in her presentation, but I think she did a pretty good job of explaining one of the things that have frustrated me personally, and that is as the virus mutates, as the virus changes, as the virus spreads in new and different ways, we too ourselves must change. We too ourselves must adjust strategies. And to complicate matters, at least in this particular question, the CDC guidelines change. And so we try to change with them. At one point in time, as Dr. Kane indicated, the CDC was very adamant in recommending a quarantine period of 14 days. I know that personally because my wife and I were quarantined for 14 days. Well, those standards have changed. And as a result, rather than just stay static, we attempt to make adjustments here in Marion County that are in line with the CDC guidelines, but take into consideration changes that the CDC itself are recommending. Is that fair, Dr. Kane? I don't want to misstate your position.
No, I think that's very accurate. I think the other thing we have to think about too is we also equally have to look at the safety of our teachers and the additional staff that are in the schools. So it's just not the children alone, but we have a responsibility of making sure that I feel comfortable that the teachers are safe in these school settings and the additional staff that are there in the school. So we try to look at all of those three things very carefully in making our decisions.
Our next question is from Abdul Hakim Shabazz of Indy Politics.
Good afternoon, Mr. Mayor. Good afternoon, Dr. Kane. I apologize for being a little bit late. I had a CLE I had to take care of this afternoon. Mr. Mayor, you know exactly what I'm talking about. Quick question. New Year's Eve and bars and restaurants and taverns, New Year's Eve is just a few weeks away. What is a midnight mandate still going to be in place at that time, or what's going to happen New Year's Eve? Because it's also on a Friday too here in Indianapolis.
Should we direct that question to Mr. Babcock? Mayor?
Oh, yeah, Paul probably knows exactly what's going to be going on in the bars on New Year's Eve. But Paul, do you want to handle that?
Yeah, thank you, Mr. Mayor. Thank you, Dr. Kane. You know, Abdul, we are at the Health and Hospital Corporation taking a look at all the different plans our sister cities are putting in place for New Year's Eve. And we'll be able to answer that question here in the next couple of weeks as we continue to look at the data. Because if there is some sort of Thanksgiving surge that may happen, you know, that'll definitely impact the way in which we go about celebrating any sort of holiday from now until next year, but specifically New Year's Eve and what we do to protect our residents in that regard.
All right, next up is Tom Healy.
Thank you. Good afternoon. This is a question that has sort of two parts to it that I hope that both Dr. Kane and the mayor can comment on. And for Dr. Kane, first, the demographics in the Marion County Health Department's situation report indicate that African American or Black non-Hispanics continue to have show a high percentage of deaths from COVID. And I'm just curious if you're modifying your outreach efforts to reach these residents.
Definitely have outlined and increased our efforts to reach these different populations by having webinars, conversations with the different leadership from the different organizations, trying to use radio spots, trying to use talk shows, utilizing the faith-based organizations to help put this message out. And this is going to be critical because one of the things that we have to worry about, and you'll be seeing a campaign related to this, is the vaccine hesitancy that is occurring with the new vaccines that are going to come out. And so we need to assure our public about the efficacy of these vaccines, how safe the vaccines are related to what we're dispensing, and how important it is in order to be protective of preventing this infection from spreading. Because one, as we're seeing the new COVID-19 cases, we now are seeing chronic long-term side effects from just having the COVID-19 infection. So it's not as mild a version as we used to think besides the mortality, but even when you're surviving, we're seeing some neurological impacts related to COVID-19. We're seeing cardiac side effects with myocarditis, inflammation of the heart. So a lot of joint and arthritis type of long-term symptoms. And so that's going to be huge, our effectiveness in this arena.
Thank you. Mayor, if this population that has been most affected by the deaths from COVID are also the statistics indicate the homeownership rate is very low for them, and as you are aware, we're facing an eviction crisis come Jan 1. I've seen figures that say an estimated 313,000 Hoosier households could be affected, but I have not seen any Marion County numbers, and I wondered if you've and your team perhaps have a count of the number of Indy households that could be affected, and with the expiration of the city's rental assistance program coming up, what else can the city possibly do?
Well, it's a very good question. I wish I could quote the total number of potentially affected households and families. I do know that I'm proud that Indianapolis, in conjunction with the support of our city county council, has had probably, one of the most robust, if not the most robust, rental assistance programs, due in no small measure because of the CARES Act direct appropriation that we received back in March. We've engaged not just in rental assistance, but also provided mortgage relief. We have prioritized food accessibility and food relief. We have provided PPE to as many different households as we could so that they are able to not only protect themselves and their families, but stop the spread to others. So I think the city's response has been robust, but you're spot on, Tom. I mean, it's almost December 31. And I think while we have spent the $168 million that the federal government provided us in our CARES Act funding in across the board multiplicity of different ways that has significantly aided households, we are very concerned that if the bickering and the posturing and the debating continues, and I speak not just of Indianapolis. I speak for all of Indiana. I speak for I think the frustrations that are felt at the state, the frustrations that are felt in other local units of government, the mayors that I talk to on a weekly basis about COVID-19. We have been consistently advocating for not just more money, although more money is necessary, but trying to engage the Congress in making adjustments to the impositions of restrictions that were part of the first CARES Act. The Chief of Staff, Thomas Cook, referred to perhaps one of the most onerous aspects of the relief package, and that was whatever assistance, coronavirus assistance you received, it must be appropriated and spent and out the door by December 30 of the end, or at the end of the year, or it has to return to Washington. And so there has been a cacophony of voices in Indiana imploring the Congress to give us more time to spend the money that they've already appropriated. And that's not to say that there's also been efforts to try to allow local units of government and state government as a whole to use the coronavirus relief funds through CARES Act a bit more flexibly. The restrictions, as are appropriate, should focus on the effects that the coronavirus has had on the public as a whole, on our businesses, on our schools, on our school kids, on our elderly, on our long-term care facilities. But local units of government and state government generally, we have other needs as well that we have tried to encourage the United States Congress to accept. We've tried to encourage the Department of the Treasury to amend the restrictions that give us greater flexibility in how the monies that we have been authorized to use can be used. So it's not been just a hue and cry for more money. It's actually been a creative approach to several different ways that the United States Congress could greatly ennoble our efforts at the local and state levels to assist our citizenry. And yet all of those suggestions have fallen on deaf ears. I sometimes wish that we could invite all the members of Congress to come to the city of Indianapolis and see how our city county council operates and how Democrats and Republicans who have certainly different philosophies and different ideologies. But at the end of the day, whether it be on the passage of a budget or whether it be on appropriations generally, Democrats and Republicans in Marion County and in the city of Indianapolis, with broad bipartisan support, in some cases unanimously, have come together to do what is in the best interests of all of Indianapolis, not just the political parties that the elected officials happen to represent. So again, I sometimes fall prey to filibustering when you get me started, but that would be my rather long-winded answer to your question, Tom.
All right, that's our time for now, but we'll send out the Marion County Public Health Department's presentation following the press conference, and you'll see it soon. Thanks, everybody.
Can I just add one comment that just really critical? Sorry, with the mayor. I just want to say, you know, the Indy Hunger Network did a study commission, and you saw the study in the Star, and Kate Hauser, executive director, really highlighted how we've quadrupled the need for foods, not only eviction from the houses, but the hunger that's taking place within our communities. So there's so many special needs that we have out there, you know, Gleaners, Second Helpings, the Midwest Food Bank, Socorro, St. Vincent de Paul, but whatever we can do to help Congress stimulate us being able to be flexible and using these funds is going to be critical in our next wave of all these cases that we're seeing compared to the pre-pandemic arena that happened. So thank you very much.
Thanks, Dr. Kane. Thanks, everybody.